All right, so we're going to start talking about some specific malignancies now and kind of get out of the general areas. The first thing we're going to do is a case. It's a 65-year-old woman who comes into the office, and she's found a mass in her breast during her monthly exam. She's been watching it for a few months, thinking, oh, it'll probably go away. But over the span of 2 or 3 months, it's gotten just a little bit bigger. It's not tender. She doesn't have any other symptoms. And when you do her exam, you're able to find a 2-centimeter mass. And you send her for a mammogram, and she has a normal mammogram. So appropriate management at this point would be to repeat her mammogram in 6 months, to watch her for 6 months, and then biopsy it if it stays there. Give her tamoxifen therapy for prevention. Send her to a surgeon for a biopsy, or just reassure her because the mammogram is normal that everything's fine. Very good. Nobody wants to just reassure her much. Good. So that is what I would do as well. There's not always a right, there's a right answer and a wrong answer, but sometimes it's hard to know. But in that setting, even if your mammogram is normal, if you've got a palpable mass, you need to know what it is. You can ultrasound it and see if it's solid or cystic. If it's cystic, then you're going to want to draw the fluid out. If it's solid, then you're going to want to biopsy it. But letting somebody else evaluate it with the intention of sampling it is the right answer there. So we're going to talk for a minute about breast cancer, okay? Breast cancer, as we said, most common malignancy in women, but the second leading cause of death, because we just said that lung cancer is the first leading cause of death. Breast cancer occurs as a malignant proliferation of the cells that line the ducts of the breast. There are going to be some things that we do as we go through all of these cancers, and screening is one of them, and I think it's important for you to be very familiar with screening, okay? And I will tell you now that looking at screening evaluations is going to make you want to run screaming from the building, because there are lots of different people that issue screening guidelines. And you'll see the ACP does it, the U.S. Preventive Task Force Services does it, usually like the American College of Gynecologic Surgeons will do it for this, and the American Cancer Society will do it for this, and they don't agree, so that's the other issue. So everybody every year is like, okay, which of these do we learn? Which of these is important? They're all important. What I would tell you is I would look at how they agree. Almost all of them have some areas where they are in agreement with each other. And those are the facts, and those are the pieces of these that are, I think, fair game for your testing. If this one says start at 21, and this one says start at 19, and this one says start at 17, they're not going to say, what age do you start? Because nobody agrees on what age you start, okay? So they're going to ask you, if they all agree that you stop at 75, they may say, when do you stop? So it's those areas that they're in agreement that are the most important for you to focus on for the test. I will also tell you now that within the last probably 3 months or so, almost all of these screening recommendations have been updated. And of course, they were all updated before after my slides got made, because we had to turn these in a long time ago. So, but also remember that your test is already written. Okay, so the test that you're getting ready to take is in its final, polishing sort of things. So the brand new ones won't be the ones that are on the test. So the things that are here will be what's tested. And the majority of the new recommendations don't really change a lot from what the old recommendations were anyway. So just be aware that there are new ones out there, and that in your practice you're going to want to, of course, know what the new ones are. But that as you're studying right now, you're going to be studying what we have available here, okay? All right, so having said that, let's talk about breast cancer screening. So the options available to us for breast cancer screening include breast self-exam, clinical breast exam, and then mammography, mammography being both a screening tool and a diagnostic tool, and then MRI for some people with high-risk disease. Okay, so those are the things that are available for screening. Now, do we use them all? Not not really, but those are the things that you have at your fingertips.